This podcast is for educational purposes only and does not provide medical advice or create a doctor-patient relationship. Please do not rely solely on this discussion. Always consult your own healthcare provider and verify information independently. If you're in crisis or experiencing a mental health emergency, call 911 or go to your nearest emergency department.
So first of all, thank you for agreeing to just share your experiences about ART, Accelerated Resolution Therapy.
Mm-hmm.
And it was 6 months ago, around 6 months, when we reconnected after working together in the wonderful world of forensic psychiatry at Providence Care Hospital.
Mm-hmm.
And after that, you went off to become a manager, a director, and then
back to being a manager.
And so you're now at you're at KGH as a manager over there. Okay. So we connected. You told me that you were doing accelerated resolution therapy. And quite frankly, 6 months ago, I had not heard about accelerated resolution therapy. It was something I knew was a gap in my clinic in terms of significant trauma. There were patients who had trauma of different grades of trauma, whether it was grief, death of a loved one, something that they could not quite process, or something more severe. But not everybody had sufficient kind of healthcare benefits or could afford the out-of-pocket expenses for more longer-term therapy. So when you mentioned ART and accelerated resolution therapy, I thought it'd be great to just share what that is about. So you're a social worker psychotherapist. So what attracted you to train in ART, accelerated resolution therapy?
I think what I liked about it was that it was very prescribed. Across the board, there's very little treatment for trauma. We don't know a lot about it, but it's becoming more and more popular and well-known. But we don't know much about treating it yet. I think I liked that sometimes in therapy, it's really difficult. It's like your mind is working a mile a minute to try to figure out what's going on and try to help the person and stay present. And this was nice because it's a protocol that you do. And so you do it the same way every time with people. There's a little bit of creativity that you can use, but you're not going to mess it up.
So, and that's what I really liked. The patients so far, my patients who've gone through it have actually had some significant benefits, even after one session. That got me thinking and trying to understand more behind it, almost being a biological intervention. Right? As opposed to just a cognitive processing of one's thoughts, emotions, behavior. So some research which I did was finding out what was it. Now, some of the stuff that I found out was that, eye movements almost replicate. So there are different hypotheses. Eye movements replicates REM sleep in a conscious state. So during our REM sleep, there's a lot of trauma processing that's taking place, connecting the left and right parts of the brain, because sometimes in those severe traumas, there's a disconnect. So, with ART, it's not just using eye movements, right? It's also, you can use bilateral tactile sensations or auditory. So can you just take us through what a typical ART session involves?
So usually someone will come in and we chat a little bit about how their week was, and then we decide what they would like to process. So what traumatic event or distressing life event or experience would they like to target for that day? And we do that by coming up with what we call a scene. So I say it's like watching a movie in your mind from beginning to end. And oftentimes people, if it's complex trauma, so something that's happened over their childhood, or something that's happened multiple times, they're not sure what to choose. So I say, pick the one that sticks most in your mind, or pick your earliest example of what you can think of, or pick the most recent, which is pretty common in trauma therapy to do kind of those three. So we identify which scene they're going to do, and then I get them to sit comfortably, not allowed to cross your legs or your arms. which is difficult for some people. And then I ask them, I always start with eye movements because that's how I was trained. We try to do that for the first session, but some people have a really hard time with the eye movements. So I ask them to rate how distressing their scene is, way they think about it, and how it affects their life. From there, we go through the protocol. It takes no longer than an hour. You're supposed to cap it at about an hour. That's about as much as your brain can handle.
Right.
I would say 90% of the time, the distress goes from an 8 to 10 to a 0 to 2. Significant reduction in stress. And I have never had a single person leave my sessions feeling undone or feeling worse than when they came in. 100% of the time, people leave feeling grounded and calm and happier and hopeful, which is another reason that I continue to use this, because I've done DBT, I've done CBT, I've done supportive counseling with people, and people find it helpful, but they do not leave every single time feeling better like they do with art.
So DBT, dialectical behavioral therapy, CBT, cognitive behavior therapy.
Yeah.
So what are the key kind of types of conditions that art has the most effectiveness on?
For me, I find like a single incident traumatic experience, particularly if people have a diagnosis of post-traumatic stress disorder from a single incident. It's the quickest. Often we can resolve that trauma in 1 or 2 sessions. And if they have PTSD, it's typically that they're having symptoms of nightmares or flashbacks or kind of that physical symptoms. So we can target that in the intervention to say, let's think of times that would typically target you or trigger you in the past. And let's test to see if that's still triggering for you. What's a little bit more complicated is someone with maybe complex trauma who has experienced it for their entire childhood, because a lot of those symptoms, they've built kind of their foundation on them. And so it just takes longer. We go really, really slowly because I would hate to leave someone undone. And so it just takes longer for those individuals.
Have you tried it with phobias?
It's a good question. It is indicated for phobias.
Right.
Maybe not phobias in I don't think they'd be diagnosed.
Right.
But avoidance, if people are avoiding certain places or things that would have triggered them. I've worked with those type of people, yeah.
So what have the challenges been with patients that you've treated with accelerated resolution therapy?
What are some of the challenges?
Yeah.
I have had some people struggle with the eye movements. They have a really hard time focusing on their scene while they're doing the eye movements. But as you had said, we were able to move to the hand pulsator, so that was a good fix.
So tell us a bit about the eye movements. What do they have to do?
With accelerated resolution therapy, we do sets. So we will set the light indicator, or we'll do follow my hand or pulsators to a limited number of sets. And so we ask them to think about either their scene, or we ask them to think about their sensations, and then they do eye movement sets. So it's not like hypnosis. You're fully conscious the entire time. You're just moving your eyes back and forth. And that alone provides significant calming and grounding effects.
Mm-hmm. So you're a social worker trained in this psychotherapy. Who else can train? I mean, apart from regular psychologists or psychotherapists, are there any other specialities that can get this training?
I think anyone with who's a registered health professional or a psychotherapist can train. You just have to have that foundational knowledge of mental health and counseling to be able to do it. But because it is so prescriptive, it's a script that we read. Lots of people can do it and do it well.
Right.
Yeah.
And what have been the most transformative changes that you've seen?
I love this work because, like I said, everybody leaves feeling better. And people have told me that I have changed their life. People have come to me just burned out and a shell of a human. And every time they come back, they look more confident. They stand up straight. They have hope for the future, and it just builds on itself. And consistently, people have said, it's too good to be true. It's too easy. I've actually had some people sad because they think, why did it take 20 years? It took us, we worked over 3 sessions. We worked 3 hours. And I feel like I did back when I was 20 before any of these bad things happened to me.
When you mentioned accelerated resolution therapy the first time, I thought it was too good to be true, quite frankly. In psychiatry, our medications for anxiety and depression, usually take a week to 2 weeks to start having an effect. Otherwise, the only other treatment modality that really works quite quickly is ECT, electroconvulsive therapy. So when you mentioned trauma resolution within 1 or 2 sessions, I was skeptical. But after you and I had met, I had done my own research. I found that this evidence was sound. Eye movement research in terms of trauma processing with EMDR, eye movement desensitization reprocessing. That science has been around and has been validated for years and years, right? So, but having then guided a couple of my patients to you for this therapy and just hearing the feedback from them, obviously I explained to them that, it's not 100%, but they have found some really amazing benefits for, I think, the 10, 15 patients that have come through, getting therapy. Okay.
I love partnering with traditional psychotherapy. So sometimes when I do this work, I will do dialectical behavior therapy, and then I do a session of art, and then we do a supportive counseling session. So it's a tool that I use. And I'll work with someone on emotion regulation, for example. Someone who has anger issues is constantly projecting and saying, it's everybody else around me. Like, I don't know why I keep inviting these type of people into my life and everywhere that I go. And as someone from the outside, you're kind of like, you're the common denominator here. That they don't have insight into that because of the way their brain works and how they've developed in their attachment style. And so we work on those skills, and then I'll do a session of art where we process something that triggers that anger, kind of the source of why they feel so angry or maybe out of control. And then they come back for the third session. And I've had someone say, I think it's me. I seem to be the one who gets angry and causes this disturbance around me. And it's shocking. I've worked with you for 2 years and I've been trying to get you to gain this insight. And I do one hour session and you come back the next time with insight. And I think the thing about art is, like I've said, it's scripted, but I don't take it too seriously either. So often we'll stop halfway through sessions and just laugh because it's so wild that it's working. It's so wild that this anxiety that they've carried with them for 20 years is all of a sudden gone. And I think that's really, really cool.
Have there been kind of cases where you found that you could have done more, or you felt that you were struggling with trying to help reduce some of that anxiety for them?
Yeah, I invite people to have skepticism when they come, because I want it to last, right? I want the impact to last. And if you're just blindly doing what I say and telling me what I want to hear, that is not going to work. But some people have a hard time of just letting the process do its thing. They kind of go off course, and some of that is okay. Some of that is let your brain do the processing it needs to. But some of it is like, you just got to let go and let the process do its thing. I don't know why it works, but you just got to do it with me. And people who have struggled the most with this have had a hard time kind of suspending that ability to just let go. Yeah.
I mean, I think, putting around, your defense mechanisms in terms of therapy, and I think the more psychologically minded people are, perhaps they would benefit the most from it. Yeah.
And I think people with really strong tendencies toward disassociation, have to be really careful with as well.
Right.
And just got to go slow and easy with them. And you'll see that with people with significant trauma histories, is that they disassociate really easily. And yeah, some of those people, we go off script a little bit. Sometimes they don't have the instant relief or the instant changing of the way that their mind thinks about it. But even if their mind isn't changing, they're leaving feeling better.
Right.
They leave feeling peaceful and calm and grounded. So I think it's still a win.
In terms of sustainability,
Yeah.
Is it sustainable, or is it just a momentary relief that they get at the time?
For the most part, it's sustained, I've noticed. But those people, the difficult ones that I'm talking about, they come back kind of every week with a new thing that's happened, and they're just not feeling great again. And then they leave, they feel better, and then they come back and things have kind of gone awry again.
So having that ideal would be having that single incident trauma, or a single trauma that would be something to process.
Yeah.
Ideally would be for art.
Yeah.
Except for like those complex repeated incidences that have occurred in childhood of things.
And those people, I would say it works really well to partner with another therapist. Because the problems that they keep coming back with are those maladaptive relationships, right? And they're in these patterns of like a poor attachment where they're just attached poorly to everybody around them. And that's based in their complex trauma history. So if they could be working with somebody else on like healthy relationships and all of that, and then also do some of the work with me on like, let's get at why you are this way, like what happened to you that made you this way, that's the perfect marriage.
That's why when I ask, so a lot of family physicians have been referring patients to me, explicitly mentioning trauma and PTSD. But I find the advantage of seeing them first is be able to determine, first of all, how severe the trauma is, if it's responded to medication. And a lot of the times it doesn't need medication. Sometimes I may start a patient on some medication just to reduce some of the initial anxiety. They undergo art, and then a lot of the times I can actually reduce, if not withdraw the medication from them.
Yeah, because it takes a lot of guts and to get here, right? It's hard to try something new. It's hard to meet a new therapist. It's hard to talk about your most shameful secrets or things that have happened to you that you've never told anyone before.
Right.
So having that, like a reduction in that anxiety to start is super helpful.
Yeah.
Then they get here and it's fine.
It's different.
It's fine.
There's so many psychological barriers they have to go through. Right. I mean, in terms of the stigma, the stigma to mental health, how long they've suffered, whether anything will work or not. Seeing a psychiatrist, some people are totally okay with it, but some people do have concerns about that and what other people might think. So they have to really go through a couple of barriers before coming here. But no, I think once they're here and once they've done art, so far it's been such a positive experience that the patients have told me. Yeah.
For the most part, people do tell me the thing that they're processing, and want to share their experience after. They want to debrief what's happened. But with this therapy, you don't have to. So I don't have to know what is going through their minds. I tell them to include everything that they can remember while we're processing, but they don't have to tell me.
And that's different to EMDR.
Yeah.
So with eye movement desensitization and reprocessing, it's an 8-stage protocol gathering their information. But because I trained in EMDR in the UK before coming here, never applied it. But you have to actually talk through every scene, whatever you're experiencing, the trauma. Some have done extremely well with EMDR. Some find it very distressing to repeatedly talk through that trauma. But the thing is, that's a fairly lengthy protocol as well. A lot of evidence base behind it. But what I found with art is that it's so quick.
Yeah.
And patients have come and told me, number of them, is that, as you said, it's been life-changing for them. Okay.
It also doesn't traumatize the therapist. So with traditional trauma therapy, exposure therapy, for example. Your trauma therapist is learning all about the things, and you see 4 clients a day. That is like the secondary trauma is real, hearing these horrific stories and all the details of the horrific stories, but you don't have that with art. So I'm not hearing all the awful details necessarily.
And the patients are getting relief.
Yeah.
Very cool. After I see a patient, and then I feel that, look, this is a really good candidate for accelerated resolution therapy. So I then connect with you and our other psychotherapists, social worker psychotherapist, and I ask them to, call our patient and just explain what art is about. So when you make that phone call, what do you talk about?
It's really helpful that you've kind of done the pre-work sometimes, because depending on the person, they've done their own research. But usually my hope is just to destigmatize the whole process, to make them feel very comfortable. And I answer any questions they might have. I set the expectations in terms of length. Typically a traditional counseling session is an hour, 45 minutes to an hour. An art session is going to be a little bit longer. Usually, like I said, they come in, we have a chat, and then we spend a full hour doing the protocol, and then we spend about 15 minutes debriefing. So it's about an hour and a half in total. Sometimes people prefer to give me a Cole's Notes version of why they're coming to see me on the phone. And sometimes people prefer to have a supportive counseling session for their first session so we can get to know each other and set some targets. So we figure that out on the phone, what they would prefer. I let them know what to expect. They know where the office is. They've met you here before, so they're comfortable in the space. And get to know a little bit about them, just like, what do their lives look like? What's a good time for them to come see me? And I usually can tell that people are feeling more comfy by the end of our sessions. Like I said, my whole goal is to make people feel comfortable and seen and understood. And like, I'm not a stuffy therapist. They can just come and be themselves. Usually people come in and they swear a little bit and they apologize, and they learn pretty quickly that it's going to be relaxed and it's fine if you want to throw an F-bomb around. And I also think it's important that, that there's boundaries in place between therapist and client, for sure.
Absolutely.
But also, it's really unnatural and weird to know nothing about the person when they know every single thing about your life. So I do share some things about my life. I share some things about what I like, that I've got kids, that kind of thing, because it just makes it more natural and comfortable for everybody involved. One of the groups that I love to work with would be first responders. And it's becoming more and more common for firefighters, paramedics, people in security, police officers to talk about PTSD. But I do still think there is stigma when it comes to mental health, and this idea that you signed up for this, and so you just gotta power through. There's been conversations with first responders and ways that they can protect themselves. But sometimes after repeated exposure to horrific things that people are not meant to see, they start experiencing symptoms. And it doesn't have to be, night terrors, or it doesn't have to be like you're a veteran coming back from war, like you can't be with fireworks, for example. Symptoms like drinking more than you want to at the end of the day because your nervous system is shot and it's the only way that you can come down and feel normal again. A huge one is anger, snapping at your loved ones, and you don't want to, and like the instant feeling of guilt. or, you know, going for trick-or-treating with your kids and just thinking like, we can't go to that house, we can't go to that house, these people aren't safe. This constant feeling of being on edge, hypervigilant, like
looking over your shoulder constantly.
Scared for your kids, scared to send them to school because you know the awful people that are out there. All of those are symptoms of trauma. And maybe you don't get a PTSD diagnosis, and that's okay. You don't need one. But I really love working with this population, and it's a great fit for them because, like I said, they don't have to talk about the trauma. They don't have to tell me all the awful details. And the trauma doesn't make the memory disappear. They'll still remember. So sometimes I'll see people feeling guilty of, you know, maybe their colleague died and they think, who am I to make this disappear? I should carry this with me. This is my responsibility. Or you see that with a veteran of, you know, their brothers lost at war, that they want to remember them. And this is a way where they can remember them as a whole person and not bring all the crap with them as well. You know, the people they've lost don't want them snapping at their families.
Correct.
They want them to move forward and live a good, healthy life. And we need our first responders and we need them to be healthy. I don't want, you know, a police officer to have to just grind it out for their 35-year career. I want someone with compassion and empathy who hasn't had to turn it off, working with my community. So I just think this is such a great fit for first responders for that reason.
And what tends to happen as well is that, you know, you have a memory of the incident.
Yep.
But with PTSD or these types of experiences, there is that accompanying waterfall of emotions, as if they were right there.
Yeah.
So it doesn't take away the memory; it just takes away the emotion, the intense emotion to that. They will feel sad when they remember what had occurred in the past, but their emotions aren't taken over on a day-to-day kind of basis. Yeah,
and they're able to enjoy the day-to-day. Maybe they're not thinking about the incident every single day, but there's just a gray cloud that has just fallen over their life everywhere. Right. And this could take that away really simply.
Any final closing thoughts? First of all, you know, a huge thank you for sharing all of that. Parting thoughts?
I don't think so. I think we've got it all that I can think of.
Great. Again, Amy, thank you so much for your time.
Thank you.
Thank you.